All right. So as you guys know, today we're going to talk a little bit about the care transition from pediatric care to adult care. I know we have a very small group here, but does anybody?
I'm going to move over so your eyes don't have to go in.
Oh, yeah. Anybody have any thoughts on at what age you think we should start transitioning or start talking about transition in care? Yeah.
Probably like maybe even as early as 16, just because you're going to be having to think about it when you're going to college, if you're going to college, and 18, and then what is it? It's 22 that you've taken out of the CHOP system.
Yeah, so it's actually the transition plan depends a little bit on what practice you're in. I can tell you at CHOP the goal is always 18, and that's pretty consistent across the board because that's a lot of things are changing then. Legally, you're becoming an adult, but really we like to begin the transition discussion as early as 12. We like to kind of make this a gradual process. We like to make it a discussion about how things are going to play out over those next 6 years as we prepare you, instead of just saying, oh, you're 18, out the door you go, head across the street or wherever you're going to be seen. So we like to really start making you aware of transition practices, kind of how we see your care playing out for the next 6 years and what our goals are to accomplish before we transition you to adult care at 18. In that same stream of thought, that gradual transition is the key, right? So we like to encourage a lot of independence, letting the patient really take charge of their care where they're able, and allowing the parent to start taking small steps back. So that when we get to that transition point and we change from pediatric care focused, which is primarily the parents making the decisions, the parents making the calls to the physician's office, the parents answering the questions, over to a more adult base where they're going to be talking to the patient. They're going to be saying, tell me how you're doing, tell me what you're feeling. Really kind of making that a gradual process, letting the patient get more comfortable with their own care and being knowledgeable, able to answer those questions. Recommendations we have for that are to call in your own refills, to get knowledgeable about what medications you're taking, what doses, really be kind of self-aware about the side effects that you're feeling, your seizures, hopefully becoming comfortable talking about your epilepsy, whether that's with your friends, with your family, with your healthcare providers, maybe bringing in a list of questions to your appointments. And then as you get closer to transition, maybe speaking to the doctor without your parent in the room for just a little bit to voice any other concerns that you might have that you don't feel comfortable talking about with your parent in the room, or just to feel a little bit more independent, gain a little bit of confidence in your ability to be knowledgeable about your condition and what's going on with you. Transition typically will occur closer to 18 if it's a complex situation with a lot of different medical needs. It can take a little bit longer just to kind of coordinate care with all the different providers that you see. But that's kind of the goal, is at 18. We always like to transition in a time when there's the least amount of turmoil. So seizures are fairly well controlled or as well as can be controlled. We don't like a lot of social turmoil or other things like that. We want to set you up for success. So if that takes a little bit longer and we keep you in the pediatric world a little bit longer, that's okay. We can be flexible and individualize the plan a little bit. But the goal is to transition you to a provider who's going to be more knowledgeable about the adult aspects of care, because in pediatrics we're focusing a lot on the childhood illnesses, the childhood treatment, and we want to make sure that the person that's treating you is the person who can give you the best care. That being said, the transition, we will make recommendations based on where we think would be best for you to transition, whether that is maybe just to a PCP, if your epilepsy is very well controlled, whether we think you need to be seen at an epilepsy center by an epileptologist, or somewhere in the middle. There's a wide range of kind of transition routes that you can take. Our transition team can occur with more than just your provider. So oftentimes social workers are involved, nurses are involved. Some centers have transition coordinators that really can help give you those resources and provide you support through that whole process. Our goal is to make it as an unsmooth process as smooth as possible. We know that it can be really troubling for the parents, especially for the patients, because that's a big time of transition in life as well, not just in your care. And then other things we like to encourage you to think about are insurance issues, guardianship issues, as you're transitioning at 18 and going to a new provider, really making sure that we have those things kind of ironed out to make the transition process smooth. And with that, I'll hand it over to Bethany, and she'll talk a little bit more about transition from the adult perspective. We consider our transition complete from the pediatric side when the first appointment is made and kept with an adult provider. So don't be fearful. We will support you up until that point, and work collaboratively, hopefully, with your new adult neurologist. But then Bethany takes over.
Thank you. So my perspective on transition is a little bit different because I work in the adult setting, and I've always worked in the adult setting. One of my roles at the Penn Epilepsy Center is to help bring the adolescents into our center. And so I work with some of the pediatric centers surrounding us to help alleviate some of the stress of that process and really walk patients through coming into the adult center. And so Sarah made some really good points. I think that the most important thing is really to think about transition as different from thinking of transfer. And so historically, when people are thinking about leaving a medical home or a medical place where they've had their care, they think of it as a transfer. They're leaving the pediatric neurologist and they're going to see an adult neurologist. And they get their records and they move things over and then they continue over there. And so that's really what transfer is just moving on over or moving on up. But really, we're now focused on transition because we understand that the change is much bigger than just moving places. And the transition focus really is more on adolescent independence, managing their own treatment plan, managing their own decisions and care moving forward, being able to answer questions, being able to be as involved in their care as possible. So understanding that some people might still need some oversight by their parents or support folks moving through. Not everybody is in the same place cognitively or medically as others, and so everybody really needs to have an individualized transition program. And that should be something that starts to be brought up as early as age 12. The other thing is we understand that it's a huge step, like Sarah said, for the adolescent and for their parents. And so making sure that you're making little steps while you're still in the comfort of your pediatric home is really important in making you comfortable making the switch over to adult care. And so having your child or the adolescent be able to speak up in appointments, just 5 minutes of the visit speaking to the provider without the parent in the room will help you get adjusted to that kind of scenario. So then when it's expected to have some time of one-on-one care with the patient and the provider in the adult setting, then that's a lot less unsettling if you're used to that kind of process. The other thing that Sarah alluded to, and we get asked all the time, is why do I have to transition? I'm so comfortable here. I like my doctor. I've been here for 18 years. I would just like to stay here forever. And the reason behind the need to transition is because once you become an adult, you really have a different you have different other medical conditions, and your body is changing and you're growing, and there are a lot of aspects to epilepsy care which are very different in children, between pediatric or child care and adult care. The treatments that are available, both surgical and medical, can be different from what's approved and used in child care versus adult care, and there are other things to consider, such as social aspects, alcohol, drugs, sex, pregnancy, all of those sensitive issues which adult care providers are much more used to and equipped with managing and dealing with. The other thing is, if you ever end up in the hospital, you oftentimes will not be able to be admitted to a children's hospital after a certain point. And so it's really important to be established with an adult provider who has admitting privileges or who's associated with a hospital, so that way if you do end up in the hospital for something else, you have an adult neurologist who knows you. And that way you can get all aspects of your care managed. And so those are some of the reasons why this is necessary. The other thing is there's a lot of growth and independence that happens socially at this time as well. So this is the time frame where people are usually thinking whether or not to leave home, whether to go to college. There's shifts in their friends groups. There's shifts in how they're managing other aspects of their lives. And so it's important to have this care transition run as smoothly as possible. And so the other thing that I really think is important is having realistic expectations and understanding that there is very wide variation in how practices work. So as important as it is for you to have a good relationship with your doctor or your nurse practitioner or whoever you're seeing in the clinic, it's also important for you to have an understanding of how their practice works. Because usually when you're aging out of pediatric care, you've been dealing with that office for as long as you've had that doctor, and you know how to get a hold of somebody if you need an emergency. You know how to get your medication insurance issues worked out. You know how to get your refills, and that's not really on all of the times on your doctor. That's really the system behind your doctor. And those systems can be very different. And so it's important to understand how the adult centers work, and that can be very individualized. In my experience, I would say that the most common cause of a transition failure, or somebody who came to the adult center and then doesn't want to stay and goes back to the pediatric provider, isn't really a mismatch of the actual treatment team when you are seen in the clinic or not liking the care that you received. It's almost always miscommunication and not understanding how to reach the office, and that difference.
For me, I switched out of CHOP to go to St. Luke's, and then I went back to CHOP because I doesn't like me to the doctor, but also because one night I missed my medication and I called St. Luke's and said, should I take another dose? And they said no. Immediately, didn't ask who I was, just said no, don't take another dose. So I was like, I'm still worried. I called CHOP. So they said, okay, here's the care team. Well, the doctor will call you back in 15 minutes. We'll know who you are. We'll get the stuff. And then he said, okay, you could take another dose. You could split the difference, or you could not. I personally would just take another dose. And that's what I did. But there was someone who cared who I was, my individual circumstances, and that's why I couldn't deal with it.
Correct. Yeah. And that kind of relationship sometimes takes time to build, right? And so I think that, and having an understanding when you meet your doctor, if something were to happen to me and it's after hours and I call, who's answering the phone? Or if I'm in a seizure emergency and I need to reach this office, how do I best do that? And different offices communicate differently. Sometimes there's nurses in the office who triage calls and will get right back to you right away. Others think that it's easier to communicate via email. Others communicate via like a MyChop system or my charting online app. And so having an understanding and being prepared for the worst, will help ease that if and when it were to happen. And so having an understanding of how the office structure works, but also having an understanding of you likely will need to adapt to some aspect of their care. So something is going to be different from the way that you're used to doing it in the pediatric setting. And so they should absolutely know you and give you a personalized answer to your questions, but you will likely need to make some adjustments to what you're used to in order to grow and become part of that center and finding a good fit for you. The adult providers certainly understand that this is a big transition period for the parents, as much as it is for the adolescent, if not more. And so there's nothing that is, hard and fast on that first visit. We're not shutting the door and not letting the parents in. We're not putting too much pressure on the adolescent, but the idea is to help you grow and manage as much as you can by yourself, and with parents' input as needed. And like I said, I kind of hinted towards all of the sensitive issues that are really play an important part in adult care, and parents oftentimes aren't aware of those issues within their adolescent, and oftentimes the adolescent doesn't want to speak to those things with the parent in the room. And so we've heard time and time again that it actually takes some of the pressure off the adolescent if we mandate that there will be a period of time within each office visit that the patient will be in the room without their parent. And if there's nothing to be said, there's nothing to be said, but it at least opens those lines if there is something to be said. And then that helps with the adolescent starting to build up some of their confidence within their own care. And then when you're actually, to talk a little bit about the physical transfer, because that's still important, is how to make sure that you get the most out of your first visit with the adult provider. And really, I always tell people that first visit is more for relationship building, giving them a chance to understand who you are and what your medical history has been. And a lot of times when people are coming out of a pediatric center, it's not the most straightforward case. There's been medicines tried and failed. Sometimes there's been surgeries tried and failed, and there's been a lot of ups and downs, and you know what worked and what didn't work for you. And so being able to speak to some of that and definitely having the appropriate records will help to start to build that relationship. I always say to obtain your records and send them to the office that's going to be seeing you well before you come to your visit. Give them an opportunity to try to look through that and learn you before they see you, so they know an idea of what's coming through the door, and so that doesn't have to take up as much of that first visit time. And then that way you can use the time to really discuss what's important to you in your care and to kind of set a tentative plan for, are you in a good place as far as you're concerned with your epilepsy? Are there changes that you'd like to make moving forward? But also not making any drastic changes while you're in that first visit, because you're not going to be the most trusting of somebody who just met you. And it's not probably the best time, because the transition just happened, to make a drastic change while you're still adjusting to the new setting. And so just having some realistic expectations and setting some appropriate goals for what should happen in that first visit, and knowing what questions to ask, can really help you feel empowered, and help you leave the visit thinking that you really got something accomplished. And so with that, I will turn it over to Josh Greene. We'll obviously after this answer a lot of questions about the process, but I think it's important to hear some of the perspective of the young adults who are in this age period going through the switch.
Thank you. I've been having epilepsy since I was 16, and I feel like these information sessions are very important to know about the transition from high school to college. It's something that everyone can benefit from, whether you're suffering yourself, whether you're a friend, relative, medical professional, things of that nature. It's always important to know who you're dealing with as the doctor, whether they're the practitioner, the neurologist, whatever their role is. It's important to know that when you're looking for a new doctor, and not just hearing it from word of mouth. You want to have a reliable source, and the EFEPA has a great referral list that can get you in the right direction as far as what you're looking for, whether it be a surgery or just regular treatment in an area, things of that nature. They're able to help you and find someone who's appropriate for where you're currently living when you make the transition. It's also an important thing to be able to look at yourself and know that you've made the transition. And for me, it was a big sign of maturity to be able to realize that I've done that. For a long time, I just said, my parents and the doctors, who are a lot smarter than me, will deal with it. And I'll just put up with it, and one day it'll go away. Eventually I realized I needed to start to learn that that's not the case, and to actively work on it. And for me personally, it's been epilepsy awareness that's helped me be able to be more comfortable talking about my personal story, and being able to talk to doctors and not just deflecting it and not wanting to face it. So I feel that that's a huge part of the transition for people that are going through it. And also knowing that it's very hard on your parents, as Sarah and Bethany have both alluded to. It could be, and it's very close, just as hard on the parents. My parents tell me every day that they would switch places with me in a second. And it's almost as hard, or it's just as hard on the parents. I'll say that for sure. So being able to recognize that as the patient is something that, if you can realize that, then you can start to realize you're making that transition and that you're maturing as well. So it's both a life and a transition milestone. For me, I like to use an example of my first seizure I had in public. It happened in a college lecture hall, and someone had asked me if I was feeling better after I'd spazzed out. That was his words. So to me, I was very upset in the beginning about it, but after a little while, it actually made me want to do more awareness, do more around the school that I go to, which is Temple University. I wanted to be able to help as much as I could. And by doing that, I found out that there were more seizures happening on campus, and people actually didn't know how to react. And I was able to teach my fraternity brothers, teach other fraternities, other sororities, how to react in that situation. And I had one in my fraternity house, and everyone knew what to do, and it was fine. So being able to teach them was not, it was able to eliminate the, oh my God, like something's going on, we don't know what to do. Being able to teach is something that also is important in the transition. You can't just leave everyone in the dark. You make new friends at college, they may not know what to do with epilepsy. So telling them how to react, a simple thing like turn them on their side, put a thing under their head. We all most likely know that, but someone else may not. So you can't just assume that they know. Because I've honestly experienced people where they say, oh, you put them on their back, right? And obviously you don't. So there's obviously education that you have to give to everyone. You can't just assume that they know the basic things in event of a seizure. And at the end of the day, for me, people learn the most from what to do when it happens. It's not really about the facts, really. It's more if you, like, if I'm hanging out with a friend, they know what to do, you know? I feel that's more important. And it's been alluded to already, but going to college is already hard enough, just going without having seizures. And then to add epilepsy onto it, it makes it even more difficult. I went a year and a half in college with every month having a seizure, every month having to give a hospital note saying why I wasn't in class, and it's not something you want to keep reflecting on. You want to keep pursuing your degree, you want to keep pursuing your dreams past college, you don't want to keep reflecting on it. But being able to reflect on it for a little bit and say it's something that you have to deal with, that's where the maturity comes in the transition. And also socially, you find out who your true friends are, and who's really in your support system. I know it may be a little bit of a cliche or whatnot, but it's really true. When you're having a procedure done, when you're having surgery, whatever it may be, you find out who really wants to be in your corner and who's really there for you when these things occur. So socially, it's very important. I mean, people, you know, obviously there's evil-minded people in the world that may think it's weird that you have a seizure, but it's something you can't control. So if they can't accept you for that, don't be their friend. But that's just me. As far as work goes, I'm someone who always tells my employer, whether it's an internship, a job for the summer, things of that nature, I always am upfront about it and tell them what's going on. I feel that it's always better to do that in case something may happen on the job. For me, I developed sleep apnea from some of the medication I was taking, and I would fall asleep randomly. Like I would be typing on the computer and then just out for a half hour. So obviously, if I didn't tell them, you can be fired, you know, it would just be a mess. If you tell them up front, it can eliminate a lot of that frustration. And it's really important to, you know, have that discussion. And while it's scary and you may be nervous to tell an employer and it may affect your job position, you know, to me, it's something that, like, we can't control. So if, and I say we as people who have seizures, so if you're having a problem talking to that employer, it may not be the best place to be. You want to be at a place where they accept you for your work ethic and not for something that's out of your control like a seizure. So that's how I feel as far as the working situation goes with seizures. And just a last general point, really. I'm sure all of you have been doing this throughout the day, but please ask questions. As far as these type of exchanges and information sessions, I find that the people I'm presenting to, as well as myself when I'm an audience member, because I'm usually not on a panel like this, I feel that I learn the most from asking questions. And it's never inappropriate to ask a question. It's always better to know than be questioning, oh, I should have asked this. You never want to have that in your mind. Like, just ask any question and someone will find an answer. And anyone from the EFEPA will help you. Like, we love doing this, so that's why we're here. So don't be afraid to ask any questions. Thank you.
Hi, I'm Natalie. I'm a student at Moore College of Art and Design, and my fine panel members made wonderful points. And I am going to talk to you about my transition from high school to college. It was really scary, but I'm also like really direct when it comes to my epilepsy. Because I had bad experiences when I was younger. Like I was diagnosed in middle school, and I lost some friends. And so I'm just really upfront, and I let people know, generally for my safety too, because I want to be safe and I don't want anyone to be caught off guard. And I get surprised sometimes because people want to know more and they ask me questions, and I love it when they do, because then I get to help them learn about it. And I tell them what steps to take if I ever have one in front of them, a grand mal one or a petite mal, because I wander during them. So, I teach them the basics, and if more, then I teach them more. Sue taught me, actually, Sue Livingston. Hey, girl. So anyway, but I would do that in high school and then more in college. In college, things got complicated because I would commute using SEPTA, and one of my commutes, I had a seizure at a bus stop, and that was really scary because I had to call my dad from the ER, and my mom could be sometimes neurotic, and so imagine my dad giving my mom that call off the wall, you know. So my mom was really cautious after that, so, and I had to be cautious because of my mom. But you know, even in college it's difficult, and I'm not even living in a dorm, I'm living at home, so I'm not spending the nights like, you know, doing whatever, partying. I'm at home. So, but it was interesting though, because I was on a particular medication and I grew immune to it. I had an immunity to it, and that's what caused my seizure. So, yeah, I don't know if that happens to a lot of people, but like, I think that I was immune. I don't know. But, also, for some of the seizure medications, they particularly affect women's health, and the side effects do. And I suffered with one medication I was on, like my time was affected briefly, and I was experiencing a lot of pain. And more than usual. And so I want to stress that any young woman go and talk to their neurologist if they're experiencing some difficult issues more than usual, because that's important. and you're experiencing a side effect. Also, around the age of 26, well, at 26 on your birthday, you are going to be taken off of your medical insurance. And that's what I found out when I was turning 26, because I'm 26 now. So 3 months before, I signed up with Medicare, and so now I'm covered and everything's fine. Yes. And is that all? Okay. And I wrote notes. When I was first transitioned, when I first was notified about going to these meetings, I was handed a list of the referral list by Sue herself, and I wish I at least glanced at it the first time. And I didn't. I actually put it in the bunch of papers that I was given at that meeting, and as something that I would look into now. I think that she has some, not here, maybe like if you email her or something, but like it's something to look into. That's all I have to say. Thank you for being here.
Thank you.
You're welcome.
So I think the rest of the time really is just for questions, so open it up. We have probably plenty of time for questions, right?
If I'm sorry, I didn't mean to cut you off.
Yeah, please do.
I just wanted to allude to there were definitely a lot of really important things you just said in there. As far as the alcohol thing, that was definitely a thing for me, as far as people thinking like, oh, he's too drunk, like that's why. And like, yeah, I was in college, I did drink for a period of time, but I stopped and sat back, and that was a huge part of my transition. I realized like, if I have a seizure because I was drinking, that's so immature of me, and I'm not going to be able to drive for 6 months because I wanted to have a Jack and Coke or something. Like, come on, that's really, for me, I'm not criticizing anyone else. If they're 21 and they want to drink, so be it. But for me, it was like the driving's too important for me. The being able to have the independence was too important, and I realized it wasn't right, and it's a shame that she got that criticism because she was drinking too much, and now it didn't even seem like that was the case at all.
Well,
So
the good
that's
news-
a shame.
I think that your situation is so unique because her first seizure happened when she was an adult, the legal adult, though maybe not ready to assume what comes with all of that with a new diagnosis. And so there are really positive things about that because she wants to be independent and she wants to control as much as possible. But like you said, epilepsy is so intricate, it impacts so many different aspects of your life that it's probably not possible for her or really any young adult to kind of hold that by themselves and fully manage that. And you really can't access anything for her anymore. That's the beauty for somebody to become an adult, that they do have full responsibility. Now, if she wants to share things like that, she can sign, releases so you can access parts of her records. But without doing that, you can still walk alongside of her. You can still accompany her to appointments. I think that for anybody, it's really important to get the message out that if they do have seizures that aren't fully controlled and they have not seen an epilepsy specialist in an appropriate center, that they certainly should, and the Epilepsy Foundation can help with referral patterns and things for that. And I think that really the best thing now that she's home and for you to help her is really give her the guidance that she needs to manage this by herself and better prepare her to then take this thing and then live on her own. And so if she's, she may just have seizures that are really hard to control. And so getting the best control of them, making sure she has the right treatment team in her corner and that she's on the best regimen across the board. But then really what she needs is support. support, and somebody to help guide her with these decisions. Insurance is complicated. Paying for appointments is complicated. And so being able to navigate that system, and she's already 7 steps ahead of so many people that are even older than her that I see in my practice all the time, that don't have a handle on that. And so I think really taking advantage of that time at home and just making sure that everything's in line the way that it should be. And it's hard for a parent to kind of sit there and feel like they want to do more. But it sounds like you've already did the best, because you raised her in a way that she's taking all of that and doing it.
And I think you being here today is like a great step too, right? So maybe you can't be as involved as you want, but you're educating yourself so that you know how to better support her, whether that's just by being there, whether that's suggesting these other resources and opportunities, whether it's going to a support group yourself, because it's just as challenging for you as it is for her, maybe even more so sometimes as a parent. But I think this is like, you're on the right track, you're in the right place. Like you have to do things a little bit on her term, and kind of, if she's giving you a crack, then respect that she's giving you a little, and
Don't try to
walk
figure out
alongside
why.
her.
Don't-
Yeah.
don't-
That honestly is how I handle it too. I mean, I know sometimes people think it's a little immature or whatnot, but to me, that's how I, look at it. And like, someone will say like, "Oh, you had a seizure," and I was like, "Yeah, I blacked out. Like, I don't remember it." And like, I don't remember it, but for me, if I handle it in a lighthearted way, then I feel better about it, and I don't have to always take this like dark situation dark. You know what I'm sorry, that was bad wording, but it can always, like, I can always turn it into a better light, and that's kind of how I cope with it too. So it's interesting to hear from another person as well.
You make a great point about using these as opportunities to educate, to talk about it, and I'm sure your daughter got diagnosed later. Like, this is a big change and a big thing to wrap your mind around, but saying like, it's okay to talk about it. Let's talk about it. Let's educate about it. Let's tell other people what's going on, and that, I think, will also help with the independence in adult care, which it sounds like your daughter's already doing a great job of, but making it more comfortable to talk about what's going on, to talk about what they're experiencing, to talk about epilepsy as a whole, I think really helps with that kind of transition to the adult piece.
A part of that is definitely applicable, because there is, obviously there's people who don't want to talk about it at all, want to keep it a secret from everyone except for the family. And there was someone on Temple's campus that was a part of an organization, and the person had it from alcohol withdrawal, and not from too much alcohol. And they wanted to learn how to deal with it, because no one in the organization knew what to do. So it took a lot of, thought, effort, maturing, thinking about how do we deal with this to make sure that this person isn't angry at us, this person, doesn't lash out. And eventually it ended up being good that I was able to share the information from the EFEPA to help them and to learn what was going on, and not just, like, throw the person under the bus. Like, it was something that they all were like, wow, now we can actually, like, hopefully this never happens again, but if it does, now we know what to do. So I think it was a little bit connected to what you were saying, just a piece of it.
I do know someone that was diagnosed like in his 40s, and he kind of thinks it's like ridiculous to go see a neurologist, and he's taking like, I think he's taking like CBD pills or oil or something like that to treat his seizures, but it doesn't always work, because like I think some seizures are too powerful and they come out, and then like but that's he's like completely resistant to the idea to see a neurologist. But the funny thing is he works with one of my friends that I met from the camp, like one of my best friends, and like she talks to him and tries to talk some sense into him, but it still doesn't work. But sometimes when he has a really bad seizure, he says maybe today's the day. And then he'll be fine like a few hours later, and then he'll be like, nah, I'm feel fine now. So maybe like later down the road he'll have like a serious injury or something, hopefully, please no, but he'll probably decide that he needs to go. But there are some people that completely deny the idea that they have epilepsy. I know it took me a long time to accept the fact that I have it. But maybe she just doesn't want to tell you everything, but eventually she'll confide in you. But I'm so glad that you're here for her.
And this is for any university, but if you have a friend, relative, yourself going through this, you obviously need to reach out to the disabilities resource, whatever they have. Temple has DRS. I get time and a half on my tests because of my medication. I'm allowed to ask for extended time on assignments. I schedule my tests with DRS so that I'm able to have longer disability resource services.
Okay.
Every college has one.
Yeah, so you're able to have these controlled environments to take your tests and talk to the teacher, and they send, as long as you send them your courses and your professors, they'll send a letter to each of your professors, and then they'll notify you when each professor's read it. So then you meet with them and they can understand what's going on as far as medication, side effects, what's been going on recently, what's been going on overall, like what can happen, and how to deal with it if anything did happen in the classroom.
When I was at community college, I had a really difficult time because I was having like so many seizures during the end of my finals. So like it was like horrible because I was taking like 5 courses at once, and like it was like, okay, it was just a lot. But I couldn't do it in the time finals were done, so I had to like do it during the time courses were done, and it was just horrible because I had to also take it in the room. There's a separate room, not just a classroom, where people could go to take their tests if they want to do it in confidence, like away from everyone. If you want a closed, quiet place, and that's where I would normally take my tests. Or if I needed a study room, that's where I would go. And you just write what you need on this paper, like what he was talking about, that would either help you learn better, help you study better. Sometimes, like if you need like a tutor, they will set you up with a tutor with like either with a professor of the same what am I talking?
Subject.
Yes, thank you. Same subject, or by the same teacher that you have. It's a really wonderful system.
Even there at Temple, I don't know if it's at every place, but they have they're able to record the lectures so you can listen to it again. They also offer these. I didn't even know this was a thing till I started at Temple. They have these pens that if you press a button, it'll record the whole lecture on the pen, and then you plug it into your computer and it'll play it back for you. So there's all these different resources for for college students to use if they're memory lapse or have a seizure during class or something like that. They're able to use all these different resources that are available from the Disability Center.
Online classes are really good too.
Yes.
So every seizure is different, and for everybody, their seizures, they might have different seizure types, or a general rule of thumb is seizures do end on their own. A lot of people you probably heard today says watch your watch, count how long it's happening. I would say a general rule of thumb is 5 minutes. They'll stop within 5 minutes. That seems like forever when you're watching somebody have a seizure, and not often do seizures actually last that long, especially the bigger ones.
But, the best thing that you can do is to stay with her, to clear the area around her, to make sure that she's not hitting anything continuously when she's seizing, or put something under her head just so it's not hitting the floor. Turning her on her side is to help the secretions pour out. So if safe, then to turn her on her side. And then to call for help, especially if it's like, approaching that 5-minute mark and you're not sure if it's going to stop, then to go ahead and call for 911. As far as knowing whether they're okay or not afterwards, we usually tell people anytime they fall from standing and smack their head on the floor, because obviously during a seizure they don't really have their defensive reflexes about them, so they're not bracing their fall. And so if the fall is witnessed and you have any concern for a hit to the head, then it's an ER trip. You should get the head looked at, just to make sure that there's no bleeding that you can't see. And then obviously if there's anything that you can see as far as an injury, a cut that may need attention, some sort of superficial injury from hitting themselves on something, then that should go to the hospital to get looked at. Other than that, there's a lot of orthopedic injuries, so injuries to like dislocating a shoulder or breaking a bone from the way that they fell. All of those things, again, need emergency attention. Other than that, it's okay to stay home and let them recover. And like you said, a knee-jerk reaction of everybody is going to be to call 911 and have them taken in to be evaluated. And a lot of times we get complaints, especially with people who are somewhat newly diagnosed. We went to the ER, we sat there for 7 hours, we left, they didn't do anything. And I said, well, good, because we don't want them to do anything. A lot of times when you have a seizure disorder, you already have a neurologist who's running the show, and who there's a lot of times there's a very fine-tuned management of medicines. And so sometimes where we run into problems is when somebody does go to the ER and there's an overconfident ER physician who decides, let me just adjust these medicines real quick and send you home. And so for most cases, if you go to the ER, really what they're going to do is just scan your head or scan any kind of body part that may have had an injury with a CAT scan or an X-ray to make sure that there's no injuries that need to be treated, and then watch you and make sure that after the seizure, usually sometimes people are tired or confused, agitated or angry. They're going to wait for that period to subside and make sure that they come back around. And then once they do, they're going to send them home. And so once you're used to seeing those kind of things, if there's no concern for injury, and if you think that they just need time to come around to themselves, then it's okay to stay home and just call your doctor.
Well, thank you all. We appreciate your questions, and thanks for everybody contributing. We appreciate it.